is Christine Alvarez, and today I'll be performing a wet to dry sterile dressing. So first I'm going to gather my supplies and make sure I check the physician order. I want to observe that if the physician requires pain meds before the procedure, or if the patient has any allergies to latex. So then I'm going to bring my supplies, go into the room, wash my hands, don on my regular gloves. And then introduce myself to the patient. Hi, Mr. Smith. My name is Christine. Today I'll be your nurse. Can I confirm your first and last name, please? Your date of birth? Okay, thank you, Mr. Smith. So today I'm going to be changing the dressing that's on your abdomen. Do you have any questions? Do you have any meds that you usually take when someone changes your dressing? Do you have any allergies? So then the patient said no. I'm going to provide for privacy. And then I'm going to bring my supplies closer and raise the bed to my working height. And then at this point I would assess the wound. So when I take off the bandage, I want to assess for any drainage, odor, necrosis of tissue, the border around the wound, and the measurement of the wound. So I'm going to be using the thumb test, so I would say approximately like 10 centimeters. And then I also want to note that it's healing really well. And later I want to make sure I remember all that for my documentation. So then I'm going to throw this out, as well as my regular gloves. And now I will set up my sterile field. So first I have my drape. When I open it, I just want to pop it onto the table. Make sure I'm opening it and I'm not flailing it around. And I'm only holding the blue part of the drape. Now I have my tray. My ABD pad. I want to make sure again that I'm just popping it onto the field. My gauze.
Okay, positive cholesterol.
So now I'm going to take my tape and make sure I have 2 pieces of tape ready for me after I put on my ABD laser on the side. And then I'm going to take my saline and make sure that my hand is over the label and just lip it a little bit and then put it into the sterile bowl. Now I'm ready for my sterile gloves. So first I'll put my dominant hand in, only touching the inside of the glove. And now that I have this one, the outside of the glove can only touch the outside. So now that I have my sterile gloves, I want to make sure it's above my waist and that I'm not touching anything else. And I'm going to take my first gauze into my clean hand, wet it, squeeze it, plop it into my dirty hand, and clean the inside of the wound first. And when I clean it, I'm going to throw this into the garbage, but for validation purposes, we're going to make pretend this is a new gauze. So I'm going to get my gauze, put in the sterile water, squeeze it, plop it in, and again one more time, just in the wound, and then garbage. Clean, and I'm going to get my new gauze, wet it, rinse it, drop it in my dirty hand, go around the outside of the wound, throw it, and then clean gauze, wet it, squeeze it, plop it in my dirty hand, and then around the other edge. So now I would give some time to have the wound dry, and I would don on new sterile gloves. And then once it's dry, I'm going to get another piece of gauze, wet it in the saline, rinse it, and now since both of my hands are clean, I'm going to open the gauze a little bit to maximize the surface area. And then I'm just going to pack the wound. Make sure my sterile gloves aren't touching the wound. So I'm going to need another one. Open it to maximize surface area. Just pack it. And then I'm going to get clean gauze.
I think that's what it was
and put it over the wet gauze.
Based on your toxicity.
So it's based on your own. Right, but what's the
And then grabbing my ABD pad, making sure that I'm only touching the blue part. I'm going to place it onto the dressing. And at this point I would go back and get my tape. And just secure the pad. And then I'm going to take off my sterile gloves, throw them out, get my tape, And I would secure the rest of the ABD pad. And then I would get another piece of tape and write my initials, the date, and the time, so the next shift knows when I changed it. And then I'm going to drape the patient. Make sure that he's okay. Are you okay, Mr. Smith? The side rail up, leave the call bell, put the bed to the lowest position. Raise the head if they ask for it. Make sure that the room's back in order, and I'm going to bring my supplies out and throw them out and wash my hands. And then I'm going to document the odor, the size, the skin around it, if there's any necrosis, any drainage, and the patient's tolerance level during the procedure.